Imagine a startling reality where as many as 100,000 residents of California may unknowingly be carrying a disease that could be deadly. This alarming situation revolves around Chagas disease, a condition previously regarded as uncommon in the United States. Caused by a parasite residing in creatures known as kissing bugs, this disease has made its way into California and 29 other states across the nation, as reported by the Los Angeles Times. Chagas disease is insidious. It can infect anywhere from 70,000 to 100,000 individuals within California, often lying dormant for years before revealing itself in the form of severe cardiac complications, such as heart attacks and strokes. The particular species of blood-feeding kissing bugs responsible for this are not a rare sight in the US, with about a dozen types present, and 4 of those found specifically in California. Notably, areas like Griffith Park in Los Angeles have a high concentration of these parasites. Shockingly, a third of all kissing bugs sampled in this popular park are carriers of the Chagas disease parasite, and local wildlife, including wood rats, skunks, and mice, has also tested positive for the illness. This neglected disease has predominantly affected Latin American populations for decades, according to Norman Beatty, an epidemiologist and authority on Chagas disease, who emphasized that it has also taken root in the United States. As its prevalence continues to grow, researchers are urging prominent health organizations, such as the World Health Organization and the Centers for Disease Control and Prevention, CDC, to officially recognize Chagas disease as endemic in the US, indicating its consistent presence in certain regions. California holds the unfortunate title of having the most residents infected with Chagas disease, primarily due to its diverse population, including many individuals from countries where the disease is considered endemic. From 2013 to 2023, Californian health authorities reported 40 human cases, out of which 31 were contracted abroad. However, officials have not ruled out the possibility of local transmission for the remaining cases. Historically, limited to rural areas of Mexico, as well as parts of Central and South America, Chagas disease has now spread to at least 30 states within the US. Current estimates indicate that globally around 8 million individuals and approximately 280,000 Americans carry the disease, likely without any awareness of their condition, according to the CDC. The challenge in tracking Chagas disease in California is exacerbated by the fact that medical professionals are not mandated to report cases as they would for other diseases like influenza, Lyme disease, or malaria. This significant gap in reporting leads to a vast underrepresentation of actual cases. Gabriel Hamer, an entomologist, noted that confirmed human cases in the US may represent just a small fraction of the actual situation, as there exists no standardized reporting mechanism or active surveillance for the disease. Many individuals only learn of their Chagas infection when they attempt to donate blood, uncovering the hidden threat that accompanies this disease. Chagas disease can elicit acute symptoms, including swollen limbs, puffy eyes, and even anaphylaxis, but its long-term effects can be profoundly severe, with risks of seizures and strokes. Other symptoms to look out for include fever, fatigue, body aches, headaches, skin rashes, loss of appetite, diarrhea, vomiting, and eyelid swelling, which may initially seem mild but often appear within weeks or months after infection, according to the CDC. The silver lining is that Chagas disease is treatable with anti-parasitic medications when identified early on. However, is left unaddressed, it can lead to dangerous and often fatal cardiac complications, such as heart attacks and strokes. So why has this potentially lethal disease received so little attention? And what can be done to raise awareness both in the medical community and among the public? These questions are vital to understanding Chagas disease's impact and the measures that can be taken to combat its spread. Have you encountered or heard about this disease before? We invite your thoughts and experiences in the comments below.